Let's start the lecture today. Do you have a high blood pressure? If it's high, you're not alone. 1 in every 3 people in the world has high blood pressure. Most of the countries. So, why does our blood pressure rise? Is it genetic? Is it because of old age? Is it innocent or lethal? Is it our destiny? Or can we easily reverse this? I will try to explain everything about blood pressure here as much as I can in our time. Also, please get ready to hear the most important life-changing blood pressure secrets as well. Okay? So, we can reverse this naturally. Yes, it's proven in the studies. There is even a diet called DASH diet for that. This dietary adjustment to stop hypertension. So there is something like that. So previously, everyone, including doctors, thought that high blood pressure was inevitable health problem that came with age or genetics. But recent studies have revealed a surprising fact. Genetics and aging have no effect on blood pressure. The biggest cause of high blood pressure is what we eat. Yes, high blood pressure is a silent, hidden killer that blinds our eyes, bleeds our brains, makes us senile, cripples us, puts us on dialysis, and kills us slowly and sometimes suddenly. The higher our blood pressure, the higher the risk of death and disability. The disability caused by hypertension is a disaster that both burdens the patient and leaves the family caring for the patient in a financial and more difficult situations for many, many years. Yes, these are scary, but as I will explain, they are not helpless situation, okay? So there is a hope. Now let's start by learning what blood pressure is. Blood pressure simply means pressure in the arteries, pressure in our vessels. Increased blood pressure is the increase in pressure caused by resistance in the arteries, while the heart sends blood to the organs and tissues. So, in blood pressure measurement, the highest and lowest pressure in the arteries indicated by 2 numbers. The first number is called systolic, the pressure when the heart contracts and pumps the blood. The diastolic is when the heart relaxes, pressure in the arteries at rest. When a baby is born, his blood pressure is 90/60. The closer our blood pressure is to those numbers, the healthiest we are. Blood pressure levels above 120/80 are a hidden killer that shortens life, causes irreparable damage to many organs in the body, and kills slowly years without any symptoms. So many patients come to the clinic with 200 or 100 blood pressure. Many times they don't even feel it. I don't feel it. I feel good. High blood pressure is not a disease. High blood pressure, hypertension, is a symptom of a disease. Therefore, it's not the high blood pressure that we need to treat. We need to treat the root cause. What's causing the high blood pressure? We should try to treat that. Is it the high cholesterol? Is it the, kidney disease? Is it too much insulin resistance? We need to treat that. So we need to do comprehensive labs when there is high blood pressure consistently to find out what's actually going on. In this video, I talk about the things that cause blood pressure. In this lecture, 95% of the causes are the heart-related, arteriosclerosis, for example. So, high blood pressure affects our body. But how does it affect? So let's look at the mechanism. If the arteries are not healthy, then the heart pumps the blood and throws it into the circulation, pumps and throws it into circulation. There is a resistance in the arteries. Therefore, some part of that blood returns because of the resistance it pumps. It comes back. This way, heart increases the pressure to be able to send it to the far organs, to our brain and to end organs. It has to increase the pressure. Otherwise, how is it going to send it to the brain? So that's how blood pressure rises. That's the mechanism. There are a lot of sensors to do that. So high blood pressure is also the primary cause of stroke, heart attack and stroke. High blood pressure that has not been controlled for many years cause these, unfortunately, disaster situation, heart attack and stroke. After the age 40, 50, patients have small changes in their brains and small bleedings. In their brain images, we can see that there is like little patches in their brains because of high blood pressure. Those are like dead zones, like brain cells dead. This is one of the biggest causes of dementia. So it's not always stroke, like, urgent, like sudden situations, like, slowly developing dementia, like Alzheimer's. High blood pressure in the very small capillaries in the eyes also cause blindness, because they are not designed for that much blood pressure, right? Kidneys, eyes, brain, like all the organs, actually, they are not designed for this much pressure. Over the time, high blood pressure damages the thin and delicate vessels in the kidneys as well, and kidney failure, and that's how the patients start dialysis. Cause of high blood pressure. Okay, obesity is one of the factors. Fat tissue causes many chemical and physical changes in the body. It increases the blood pressure. Nowadays, with the increase even in childhood obesity, even the children have high blood pressure right now. There are even like teenagers, even the younger than teenagers, that we start the blood pressure if they are not following the diet, unfortunately. If you are overweight, if you lose 10 kilos, you will reduce your blood pressure by 10 points. Yeah, this is proven in the studies. High sodium intake. So this is the next reason why we have high blood pressure. Excess sodium retains water and causes swelling in the blood vessels, as well as causing the vessels wall to contract. Like everything swells up, basically. That's why the pressure goes up. Excess sodium is not easily eliminated, so it does stay in the body for a long time. It takes days, weeks for the salt to come out, especially if you're eating salt all the time. So there are thousands of studies proving that blood pressure decreases when the salt is cut out. For example, one of the earliest studies for that is 1939. In Duke University, Dr. Kempner did a study without adding any salt and oils. He gave the patients only fruits, vegetables, and rice. It's called rice diet, actually. In this study, blood pressure of the patients was lowered from 250 to 120. So the study shows we consume as much sodium as we need from the plants, like fruits and vegetables. We do not need to add any salt to our food. Even apples contain sodium. American Heart Association dictates that the human body needs around 200 milligrams per day. He recommends it between 200 and 500, no more than 500 milligram, meaning no salt added. If you don't add salt, and sodium comes from fruits and vegetables, enough amount. Your cells and vessels, your arteries are going to be flexible, relax, and no high blood pressure. When there is no salt, not too much sodium, there won't be much blood pressure problem in your life. So the younger your arteries are, the younger we are. So as I mentioned, like fruits and vegetables, it's not just like, oh, okay, eat your fruits and vegetables. It's actually like diet that's called DASH, dietary adjustment to stop hypertension. That's American Heart Association recommends, which is just basically fruits and vegetables. So Mediterranean diet, basically, you remove the salt, it becomes DASH diet. So DASH diet, the goal here is to increase the potassium, reduce the sodium. According to studies, DASH diet reduces the blood pressure to normal levels in 2 weeks. Even if you're going to add the salt, you can add after you cook to the surface of the food so that you can taste the salt. So with a very little amount you can get away without putting teaspoons of salt to your food. So 1 teaspoon is 2,300 milligram. So this amount, the same with the Himalayan salt, rock salt, sea salt, whatever you take. You know, some people say that, oh, the salt is better. It's the same thing. 2.3 grams of sodium in 1 teaspoon you're getting. And every gram you're reducing your blood pressure also 5 points. It's a big deal. Additionally, salt restriction is not only important for blood pressure, it's important for to prevent from cancer like stomach cancer, esophagus cancer as well, and then, you know, to prevent osteoporosis, joint problems, rheumatism as well, because, you know, salt causes inflammation. And if you eat without salt for a while, you just even going to be able to taste the sodium in the fruits and vegetables. That happened to me too. You know, I could taste how celery sticks are so salty, so, you know, so much sodium, even tomato. Now it's the fat. So fat causes high blood pressure too, because the fat thickens the blood. It's like sludge, causes sludge, like slimy, right? It's harder for the heart to pump its slimy, sludge blood than blood like water. So there's a resistance in the arteries when we eat fatty meal, basically. And the studies show that oxygen amount that's carried drops by 20% when we eat a fatty meal. Chest pains and heart attacks are often caused by fatty meals after we eat fatty meals. So it's no surprise that heart attacks mainly happen in the, when people are sleeping after dinner. Cutting fat reduces blood pressure by 5 points in 5 days. In just like a few days, even 3 to 5 days. If you don't eat fatty food, if you don't eat salty, look how much you're going to drop the blood pressure just like naturally. Insulin resistance, prediabetes and diabetes is one of the reasons, because excess insulin levels hardens the arteries. It causes sodium retention, water retention, so electrolyte imbalance. So that's why we should try to reduce our insulin resistance, insulin levels in our blood. So basically we should control our diabetes if we have. And sticky blood in diabetes, sticky blood, like because of too much high blood sugar in the arteries, it's sticky, and then again it's harder for the heart to pump that blood. Inactivity is another reason. Sedentary lifestyle, of course, if you don't move, your blood pressure circulation is not going to be good, and then you're not going to be able to reduce your blood pressure. So 30 minutes walk a day, if you walk 5 days a week, you reduce the blood pressure 9 points. It's just big deal. Sleep problems are also one other reason for this. Sleep disorder, sleep apnea, constant stress, living in a stress like that is increasing cortisol and raises the blood pressure. So that's very well known. Caffeine is one of those. Caffeine mimics like stress and anxiety, increases the cortisol. So we should try to avoid it if we have high blood pressure. Alcohol and smoking also, it hardens the arteries and causes high blood pressure. So reduce the caffeine, quit alcohol, quit smoking. When to consider blood pressure medication and their side effects. So if it's over 140 over 90, like multiple times in doctor visits, and in between we ask the patients weekly, keep a log daily. So we look at them, because the true blood pressure is the blood pressure taken at home, because they usually come right away as soon as they walk in. We check their blood pressures, and then in the morning hours, of course, blood pressure is higher, and they are talking probably at that time, and just like blood pressure always, in the mornings when the patients come, it's like high. So we just don't want to go by that. So that's why we see their blood pressure log at home as well before we decide on the blood pressure medications. So why do the blood pressure goes high again? When we try to send the blood pressure, blood to the brain and the other organs, it increases, right? That's why we don't want to drop it too much, with the medications. That's not good, because you may not receive good enough blood pressure, blood to your brain. So that's why, with the medications and the nutrition, we don't want to drop it too much together. So if you're doing dietary changes, please let your doctor know, so that you don't end up with low blood pressure. That's even more dangerous than high blood pressure, because you're gonna fall and break something. So that's not right. So please let your doctor know if you're making any changes, and also they are starting you on blood pressure medication. Don't cause dangerous situations. Okay, so this blood pressure medication, there are diuretics. They give you, kind of like dehydration, basically. They get the water out, so you kind of like dehydrated. So be careful, dizziness. So try to drink enough water. And then electrolyte deficiency is one of the, side effects of this too, because constantly you're getting the water out from your kidneys. So beta blockers, they reduce the heart rate by reducing the contraction of the power of the heart. So like reducing the power of the heart, that does not sound right? So I hope you never have to take this medication, right? You don't want to reduce your power of your heart. So it does it by reducing the adrenaline hormones, and for that reason it causes fatigue and weakness. These people usually are very weak. So ACE inhibitors, they reduce the blood pressure by suppressing some certain enzymes, angiotensin converting enzyme. So side effects is usually like cough, dry cough. So then we can't really continue on this medication if they have this side effect. So we have to give another blood pressure medication. So calcium channel blockers are, they block the calcium channels, and that way they dilate and lower the blood pressure. They dilate the vessels and, lower the blood pressure is a side effect. So these patients sometimes come with like facial swellings, or they come, I have swelling my ankles, like, I never had this before. So yeah, we just had to stop this blood pressure calcium channel blockers and give something else. And there's these angiotensin receptor blockers. They are also cause dizziness, weakness, headaches. So it's better to not take medications and just do it naturally. It's a lot of side effects. And I have patients that come with like 5 blood pressure medications and their blood pressure is still high. So if you don't do anything, if you don't change anything, it's like blood pressure can do so much. Okay, blood pressure medications overall also cause long-term heart disease, chronic constipation, like cancers, even like breast cancer, psychological disorders. So try to stay away, basically. If you're taking blood pressure medication and eating healthy, we said you're gonna talk to your doctor, they are gonna stop, and they are gonna ask you to check your blood pressures at home. If it's like too low, don't take it. So be careful. Okay, so now let's talk about the secrets. 4 secrets to reducing blood pressure naturally. First secret is potassium. Increasing the potassium is sometimes more important than lowering the sodium, because we need potassium too. Potassium we need for many reasons. If the sodium in the cell increases, potassium decreases. So it's like, it's in a balance, seesaw. So if we increase the potassium in our diet, sodium will automatically drop. How is that going to happen? With, again, fruits and vegetables. A lot of potassium in fruits and vegetables, very well balanced with sodium, and then your sodium will automatically drop and your blood vessels are going to relax and blood pressure is going to automatically drop. Okay, let's look at the salt and sodium amount in the ancient world. The ratio was 1 to 100. So people were eating like 100 potassium to 1 sodium ratio, because people were not consuming any processed food. So there was not a lot of sodium in the diet. So with the decrease in vegetable consumption and then increasing in the fast food, so now the people are eating like 1 to 5 ratio. We should eat at least 5 to 1, but we're doing just the opposite. 5 sodium, 1 potassium. So that's the biggest reason, I think, potassium deficiency, not only too much sodium. So normal daily sodium intake 300, we say, not more than 300, not more than actually like 500, let's say. So we have to eat a lot of fruits and vegetables, like 10 times more than that, right? Let's say like 10 glasses of fruits and vegetables we have to eat to balance that, okay? So potassium deficiency is not good, we said, okay? If we eat enough potassium from like DASH diet, we can reduce our blood pressure 5 points. Okay. So in the past, let's see how they had this 100 to 1 ratio. You can tell from here, apple has potassium 120, sodium 1. You see, even like eating 1 apple it puts you in a ratio 120 to 1. So it's not like just 5 to 1. Potassium in banana is 358, sodium is 1. That's why when you have potassium deficiency, just banana, that's why they say that. Potassium in sweet potatoes is 440 and sodium is 70. Potassium in lettuce is 247, sodium is 8. With berries, potassium 100, sodium 0. As you can see, the balance of the nature automatically reduces the blood pressure. You don't even have blood pressure if you eat like this. You know, I never had high blood pressure in my life. I'm 53. Okay, so, but as you see, for example, even for children, they eat those cereals, they have 350 milligrams sodium and 0 potassium in those cereal boxes. Nothing. So even in childhood, that's how it starts, you know, unhealthy eating, and then we see high blood pressure in children. Okay, so we can eat potato, tomato, watermelon, spinach, dark green leafy vegetables, chard, avocado, bananas, apricots, raisins, broccoli, zucchini, all the fruits and vegetables. You don't even need to count. Okay, so the other secret is magnesium. Magnesium relaxes the arteries, relaxes the body. This sodium-potassium exchange in the cell also happens with magnesium. So magnesium acts together with potassium. Your cells use potassium to reduce sodium, and also they need to increase magnesium in this balance. Additionally, magnesium keeps all the electrolytes in balance, so you need magnesium. So how are you going to get the magnesium then? Then again, fruits and vegetables, because magnesium is inside the chlorophyll, inside the center of those green leafy vegetables. So that's how you get the magnesium. But if you want to take the pill, go ahead, like 300-400 milligram before going to bed. If you want to sleep well as well, that works. Okay, like take magnesium as one of the ways to reduce your blood pressure. Third secret is nitrates. Where are the nitrates? Nitrates are in the fruits and vegetables too. Okay, the nitrates we eat from the vegetables and fruits converted in nitric oxide with saliva and in our stomach, intestines. So nitric oxide keeps arteries open. Like potassium and magnesium, nitric oxide is also relaxes the arteries and lowers the blood pressure. So what are the fruits, especially for those we said greens and red ones, like red beet? Okay, so that's a lot of nitric oxide. That's very well known. Athletes use that. They do beet juice doping before their races and things. Okay, so as you see, we see the power of plants: potassium, magnesium, and nitrates. Okay, so that's the DASH diet. This is proven. We gotta eat vegetables and fruits for our heart health, artery health. Okay, so if you eat like that, according to studies, your blood pressure drops by 18 figures, okay, in just few days. 18 figures. It's just like, let's say you have 140 over, let's say, 90. So your blood pressure drops by 18 figures. That's 120. It's like it goes back to normal. And, in this lifestyle, then you need to stop the medications too, as I told you earlier. So you can't just take medications and then eat good. Like it's gonna be too much low blood pressure, and you're gonna fall. Okay, it's also proven with populations too, like blue zones. I don't know if you saw the documentary, if you read the book. It's the National Geographic did this long-term study in the blue zone populations, they eat 95% plant-based. That's why they never have high blood pressure. They are not on blood pressure medications. Fourth secret is intermittent fasting. Intermittent fasting reduces high blood pressure. It's proven with the studies. It drops 37 points, okay, in 1 to 2 days. Because there's no sodium intake, there's no food intake. Insulin drops, inflammation drops, it's just like from many aspects, okay? Sodium drops, inflammation drops, no insulin, nothing to harden the arteries, just water, just like blood is like water. There's no high fat, so it's not sludging, no stickiness, just like human body is a hydraulic system. It's supposed to be a hydraulic system, not just a sticky sludge, slimy like that. That's why we have high blood pressure. Okay, so 16 to 22 hours of intermittent fasting helps a lot. Like either early dinner or skipping, or maybe eating late breakfast would help with that. Okay. Okay, so yeah, I just wanted to give an example. I do this driving, the commercial drivers, like clearance reports, and then when they have high blood pressure, because they cannot be on blood pressure medication, like it has to be naturally low. So if they have high blood pressure, we just give them this diet. In 2 days they come back, blood pressure is normal. You see, when they have to, they do. So they have to take that driver license, right? That's their work. Otherwise, they cannot get that job again. So that's why it's proven that with the diet, they can reduce the blood pressure in just like 2 days. Okay, so it looks like we understood that fruits and vegetables is the key. Intermittent fasting helps a lot. So basically, we shouldn't keep eating, especially fatty food. If you're eating always salads, smoothies, and soups and things, it's no problem. But if you're eating fatty meals like 3 times a day, 4 times a day, that's a problem. That's why intermittent fasting helps. Okay, so there were questions. Let's finish off with those. So one question was why the blood pressure is highest in the mornings and why is like lower in the evening. So it's because of the biorhythm in the morning. How our body gives us that boost with the blood sugar. The blood pressure is the same as well. So it's a little bit increased cortisol makes you get up and going for the day. So that's normal. So yeah, don't go by just like morning blood pressure, okay? So it's just gonna come down. Just eat good during the day, you're gonna see that blood pressure is fine. And normal blood pressure range is we don't want it to be, so the number was 140/90 before, like 6-7 years ago. We were going by that 140/90, but actually American Heart Association reduced it to 130/90 now. The cutoff is now like even smaller. So because heart attacks are #1 reason for death for all over the world. So that's why now they are trying to keep the blood pressure control more like tightened. So that's why if they are checking at home, they are bringing you the log and it's always over 130/90. So that's a reason to start the blood pressure medication. So of course we tell the patients to eat this DASH diet, fruits and vegetables. We always emphasize those, but if they are not watching, we have to unfortunately start. And even the kids now, teenagers are on blood pressure medications. That's so sad, actually. Okay, so yeah, the patients, they don't feel it. That's why it's called silent killer. There are patients coming in, let's say the dentist sent it to us, the eye doctor sent it to us. They check the patient and it's too much high blood pressure. We can't do anything to you. Just go to your primary care doctor to control the blood pressure first. They come and I don't feel anything, doc. Like, it's like 180 over 90, 180 over 100, they don't feel anything. So because they've been living with that blood pressure for so long, so their body kind of got used to it. But doesn't mean that the organ damage will not happen. So that's why just because you feel fine, it doesn't mean that that blood pressure is like harmless. So but some people have like low blood pressure, you know, mine is like 80 over 40, 90 over 50 sometimes. It's just like, I don't feel dizzy. So, you know, it depends on the person too. So remember, like a newborn's blood pressure is like 90 over 50, 90 over 60. So, you know, we are supposed to be as close to that number as possible, okay? So how can we reduce it with naturally? And then, you know, as we all talk about these things, fruits and vegetables, that's it, okay? So majority of your plate should be fruits and vegetables. So, and then one question was, do vitamin deficiencies cause that? So the vitamin D is known with that. If you have vitamin D deficiency, it may cause, or, you know, they are trying to see the correlation with that. Some vitamin D supplemental studies helped with reducing the blood pressure, but there are not a lot of studies for that. So it's not like there's no big correlation. So, but if you eat a lot of fruits and vegetables, you won't have vitamin deficiencies anyway. So, you know, go out in the sun, walk, and get your vitamin supplementation. We always recommend that anyway, so it's not gonna be a problem. Okay, if there are any questions, I can answer. Let me see if there are any questions here, if I can see. I'm not able to see anything. My previous Turkish one is up here. There are no questions there. I don't see my new one, the one we're doing right now. I don't see it on Facebook group yet. That's why I can't see the questions. Maybe if you have a question, please type. I see my friends here, but I don't see any questions. So if there is no question, I'm finishing off right now. I'll go to work, okay? Next week we will meet again. Please write which subject you want me to discuss. Otherwise, I'll choose one, okay? So next week I'll be here again, waiting for you guys to join. Okay, bye.